So let me start with again, the Ruby trial, about 494 patients all in. And this is, as I said, after additional data, 3 years of follow-up. And this looked at two different populations of patients, those in whom, as I say, by stratifying by age, patients who were older than 70 and patients who were less than 70. And the numbers, there were approximately 349 patients who were less than 70 and 145 patients who were greater than or equal to 70. And what we saw altogether in the overall population, looking at the entire group of women, is that there was an improvement in the time to first subsequent treatment and time to second subsequent treatment. In other words, the length of time before the patient needed her second treatment or a third treatment after the original combination of Taxol and Carbo and Dostarlimab was significantly longer for the entire population. And was in the younger population, this was 2.9 and 12.6 months respectively longer for the younger women. In other words, they had a prolongation of that disease-free time or treatment-free time for the women less than 70, but also for the women greater than 70 with prolongation by 8.7 and 8 months respectively. And this is a significant finding when you consider the quality of life of these women that is afforded them by having this longer period of time. And really, I think, speaks to the durability of the regimen and the fact that there's a sustained benefit for patients with this therapy of the Taxol and Carbo and Dostarlimab. And then the second endpoint that was of interest in this particular trial was looking specifically at the population of women who have what we call basically mismatch repair not deficient, or stated another way, stable tumors. This population is important because this is a population in whom we tend to see a worse outcome globally. And again, what we found for these patients is that time to first subsequent treatment and time to second subsequent treatment were also prolonged, even in this cohort of patients for whom we would have expected they would have worse outcome. So all in, this really suggests, whenever we look at a novel treatment, is the benefit sustained even beyond the treatment, the initial treatment, and also is that something that is that benefit seen for women who are older, in whom it has been argued perhaps that these immune checkpoint inhibitors, which require a functioning immune system, it has been suggested that perhaps older patients do not have as robust an immune response, and might we see that they don't gain the same benefit as the younger cohort. We did not see that with this study. We saw, in fact, that benefit was equally enjoyed by patients who were older as well as younger, using 70 years of age as a cutoff.